I know that once men reach their 60s, many begin to think that sexual health, intimacy, or penile care no longer matter. They assume all they should worry about now is heart health, blood pressure, or diabetes. But the truth is, sexual health is inseparable from overall well-being, and small changes in how we care for ourselves can make a huge difference in quality of life. As a doctor with over 25 years of experience in senior health, I've seen countless cases where neglect, embarrassment, or lack of knowledge led to unnecessary consequences. And I'm here to say this: it is never too late to start taking proper care of your penis. There's something not many people realize. The penis, like every other organ in your body, needs to be used regularly to maintain its function. If you stop using your arm muscles, they weaken. If you stop engaging your mind, your memory declines. And if you completely stop your sexual life for a prolonged period, your penis is affected too. I'm not just talking about intercourse or masturbation, but about blood flow and oxygenation to erectile tissue, the very essentials for maintaining sensitivity, erectile strength, and reflex response. For men who no longer have regular sexual activity, I often recommend using a vacuum erection device or engaging in pelvic floor physical therapy. Just a few minutes each day can significantly improve flexibility and restore natural responsiveness. Proper hygiene is the next thing I emphasize. Every week I see cases of minor infections or worse, chronic complications stemming from poor hygiene habits. Some men use strongly scented body washes that irritate the genital skin. Others forget to dry properly after washing, creating a moist environment perfect for bacterial growth. And many forget to wash after sexual activity, something I always stress because the difference in pH between the vagina and penis can disrupt the local microbiome. My advice is always this: use mild, unscented soap wash gently every day and dry thoroughly. Think of it as caring for your face, meticulous, consistent, and intentional. One thing many people don't expect is that engaging in intercourse before full erection can cause micro-injuries leading to fibrosis, deformity, and painful erections. I once treated a man who developed an abnormal penile curvature after months of having sex while only partially erect. The repeated tiny injuries, though seemingly insignificant, accumulated over time. That's why I always tell my patients, don't rush and never pressure yourself or your partner. Wait until your body is truly ready. Now, I want to touch on a subject that I know might make some people uncomfortable, but it's necessary: pornography. I don't condemn watching adult content, but I've seen far too many patients lose real-life sexual sensitivity because they've become accustomed to artificial stimulation. One man told me he no longer felt aroused when touching his wife, even though she still loved him deeply, because his mind was filled with nightly images and sounds from porn. That broke my heart. Not because porn is inherently bad, but because it replaces real emotional intimacy with conditioned neurological responses. Pleasure no longer comes from connection. It comes from a solitary reflex. If you find yourself dependent on artificial images to masturbate or climax, maybe it's time to pause and ask yourself what truly makes me feel fulfilled. In my view, sexual health is the outcome of a whole system. It's not just about hormones or blood vessels. It's about how you live every day, how you eat, how you sleep, how you manage stress, how you care for yourself. A balanced diet with plenty of greens, limited processed food, adequate hydration, and good quality sleep are all essential. Additionally, avoiding tobacco-limiting alcohol and maintaining a healthy weight are all scientifically linked to better sexual function. I often compare this to tending a garden. If you water but forget the sunlight, or fertilize but don't weed, the garden will never truly flourish. One of my favorite tips, and one I always share with my patients even if it sounds a bit unusual, is to sleep without underwear. Many men don't realize that while we sleep, natural nighttime erections occur. If the penis is constricted by tight underwear, repeated pressure can cause tiny injuries that we don't notice immediately. But over time, this can lead to fibrosis, painful erections, or even curvature. So my advice is simple: let your body breathe at night. Loose-fitting shorts or nothing at all. Not only does it feel more comfortable, but it's a quiet, effective act of self-care. Lastly, I understand that not everyone can change their habits overnight. But if you're still with me now, it tells me you're ready to start. Maybe it's as small as switching soaps, picking new sleepwear, or spending 5 minutes each evening on pelvic exercises. Every small step matters. And if you feel you need extra support, there are many natural options, from herbs to traditional therapies that can enhance sexual function without strong medications. Just be sure to choose wisely and do your research before trying anything new. I hope you've felt seen, understood, and inspired by this conversation. If you'd like to keep receiving thoughtful, gentle, and expert-backed insights like this, please follow our channel, Seniors Live Healthy. We're here to walk with you on this journey of natural, mindful, and loving self-care.